So there we go. All right, Pamela and Mary Beth, do you want to do quick introductions?
Hello? Hi,
yes,
this
we can hear you.
Okay, I'm sorry. I had to take myself off mute. Hi, this is Pamela Harrison with NASCASP, and I am the CSBG State Assistance Director, and just very happy to be participating in this collaborative effort with the partnership.
And hey, everyone. This is Mary Beth Schnaber-Remrez. I'm the CSBG State Assistance Deputy Director, and echo Pamela's sentiments. I'm very happy to be with you today.
All right, so let's go ahead and get going. And Courtney, it looks like you're the one with the ability to advance the slides, so let's go ahead to the next slide. All right, so quick agenda. My guess is we'll probably run for about half an hour today. Many of you have already gone through the process for the State TTA plan, so this is hopefully a refresher for those of you who are familiar with the process. But for those of you who haven't gone through the process, and there has been some turnover in both state associations and state offices, we wanted to make sure that everybody was clear about how the process works, how you're supposed to fill out the forms, and of course, at the end, we'll take any feedback from folks about any last-minute edits or changes so we can finalize the materials and get them out to you by the end of next week. So we're going to start by talking a little bit about the submission process. Then we're going to review the template itself, make sure you're clear on how to fill out each section, and then we'll open it up for questions and feedback. And again, just a reminder, we're getting some feedback from folks, so if you mute yourself on your end just to cut down on background noise, that would be great. All right. So to review the State TTA plan process, just a brief historical overview. Of course, the State TTA template was developed as part of both the Organizational Standards Center of Excellence grant that the partnership manages, and of course the RPIC grants that we are currently in the last year of, but the State TTA plan will continue into the future RPIC grants and the Human Capacity and Community Transformation grant that will start at the end of September that the partnership has applied for and will work closely with NASCASP on. So there are no changes in terms of the continuity of the TNTA plan. It will continue for the most part as we've been doing for the past couple of years. So just to remind you, the intent of the plan is to encourage collaboration between state associations, state offices, and agencies at the state level to plan and coordinate your TNTA activities. And Mary Beth and Pamela are going to talk a little bit more about the importance of making sure you're collaborating on your plans. But they also help support regional collaboration by identifying those shared TNTA needs and helping you share resources, things like needs assessments that you do with your agencies, obviously prioritization of needs, and any other resources that you'd like to share. And of course, they help us at the national level by providing us that big picture overview of our TNTA needs as a network. Next slide. So to provide additional detail about the process, we're still waiting to hear from OCS on the exact due date, but we anticipate it'll be roughly the same time it was last year, which was October 19th. So we've still got about 3 months for the process, so you've got plenty of time to develop your TNTA plan. And of course, we'll let you know as soon as we get that final guidance from OCS about when these will be due. But just to remind folks, especially for those new RPIC leads, and I think we have at least 2 in the network, the RPIC lead sets the due date for the plan prior to the deadline. So I think most RPICs made their state TNTA plans due a week before that October 19th date. So just make sure that if you are an RPIC lead, you are communicating to the states in your region when they need to get you those finished plans. And then the state associations send their plans to the RPIC leads on the date they select, and in turn, the RPIC needs will send them by October 19th or whenever the deadline is to OCS, the partnership, and NASCAS. So it's a fairly straightforward submission process. State associations working in collaboration with state offices develop the plans. You send those to your RPIC leads, and the RPIC leads send them to the national partners. Also, the state TNTA plans are meant to be prospective, looking forward to your TNTA activities for the upcoming year. We know that some states start on a different fiscal year than the federal fiscal year, so hopefully you have enough time to do that planning at the front end, and hopefully most of your fiscal years haven't started, but if they already have, you would just develop the plan sort of in process and would hopefully still be a help to you in coordinating your TNTA activities. So if you've already started or are about to start on your state fiscal year, you would just go through the process the same as anyone else, just knowing that you might have already started to deliver some of that training and technical assistance. Next slide. Right, and our partners at NASCAS are going to talk a little bit about collaboration and the plan itself.
Yeah. So the state TNTA plan, it is a joint plan which should include the state CSBG lead agency in the planning efforts. You know, keep in mind this is a collaborative process, and at the state level, it is essential to have input from the local community action agencies, state CSBG lead agency, association, and the RPICs. Each of these key partners will provide crucial information that collectively will result in a comprehensive TNTA plan that will benefit the network. Also, it is a plan and it is acceptable to make adjustments and revisions during the course of the year. So as you're moving through the TNTA plan and you identify, you know, some areas of adjustment or revision, that is perfectly acceptable. As it says on the slide, it's not a contract, it's not set in stone, and you would actually want to look at the process and identify those process improvements as you're moving forward. Next slide.
All right, so the template sections are the same as they were last year, so this should be familiar to most folks. The only thing that I want to call out as being new is we've added in that 1C section, and we'll talk about those questions when we review the template itself. But we obviously are moving into the Human Capacity and Community Transformation Initiatives starting next year and running for the next 3 years. So we did want to make sure we had gathered some initial feedback to help get the ball rolling on TNTA in year one of that initiative. So we'll talk a little bit more about what those questions are, but I think they really only amount to a couple more paragraphs. So no substantial changes between the version you filled out last year and this year, but now we're going to go to the template itself and go through each of those sections and just give you the basic tips and suggestions for how to fill it out. So Courtney, if you want to advance to section 1 on the needs assessment. And of course, the template itself comes with instructions for each of those sections, but I'm now going to turn it over to Pamela and Mary Beth to talk about the needs assessment process and those high priority TNTA needs lists. So Pamela and Mary Beth, take it away.
Great, thanks. So in terms of that needs assessment process, which is section 1 here, what we're looking for is really 1 or 2 paragraphs that talk about how the state office and the association assessed the needs of the agency. Ideally, this is done in tandem and coordination with one another. This is an opportunity to ID those promising practices and lessons learned as well in your needs assessment process. If you know me, you know one of my favorite terms is progress, not perfection. So don't be shy to highlight those promising practices that move the needle. The processes that you may highlight here might include information that you get from those, some state offices have quarterly meetings with the network, might be through monitoring findings, it may be through those board meetings at the association, or a formal needs assessment tool or survey. An important point to make here is that you can also attach your needs assessment to this document, and then that can be shared at the regional level and help benefit your peer state. You also want to make sure that you include a description of how this information is ultimately going to be shared to the region. This doesn't have to be complex. This is a simple plan to email the results to the lead, post on the RPICs website or Slack or other platform. Jarl, Courtney, anything you want to add there?
I think that sums it up nicely. And again, we're really only looking for 1 or 2 paragraphs describing that needs assessment process. So don't make it any more complex than it needs to be.
Cool. So then in terms of your top prioritized needs, this really needs to be a conversation between the state office and the association, as both may have differing perspectives on those top needs, and that's just based on the different roles that we each have. And we really need each other to ID those high priority needs to get a full comprehensive picture of our network. One point to make here is you'll notice that this is free form text. This isn't a drop down. So it's really up to the state office and association how you want to frame your needs. We're not looking for uniformity of language. This is open-ended, so you can frame accordingly. So you can give the header as appropriate. It might be human resources or data analysis, but then give us a sentence to give some detail about this need so we understand kind of the crux of it. This list is going to help drive our national and overall approach to TNTA and help us track emerging needs, and also ID any of those kind of sticky needs that have been around since we started. So, Courtney, Jarl, anything to add there?
And I just want to underscore this list really helps us at the national level see from a big picture perspective what those needs are. It drives a lot of our TNTA planning. So this is extremely helpful information. But as Mary Beth said, hopefully a good opportunity for the state office and state association to make sure they're on the same page, look at their perspectives and come to consensus on where they're going to focus their TNTA activities. And Courtney, you do a lot of the data. I was going to say, Courtney, you do a lot of the data aggregation on this. Anything to add here?
Not necessarily. I think the way Mary Beth described it is good. Definitely having that kind of header or main descriptor word of, what the kind of category of need is. And then with just a sentence or two, it doesn't have to go in great detail, but just a sentence or two clarifying what you mean by that need is perfect as we aggregate the data.
Great. And Mary Beth, anything else?
Yeah, I just wanted to point out the additional comments section, that this is an opportunity for you to provide any additional comments or context that you think is important for us to know at the national level.
Great. And again, it's just helpful to get that, any additional details, if there's anything in particular that stands out or you'd like to call the national partners' attention to. All right, and then the main new part of the template is for the Human Capacity and Community Transformation Initiative. I know that, many of you haven't even started these, the new grants, both the HCCT Center of Excellence and the RPIC grants don't start until September 30. But we wanted to make sure that we were collecting data to help us plan our TNTA efforts and, of course, hopefully help you do some advanced thinking. So we tried to keep this section as straightforward as possible, but our grants also do require us to use the state TNTA plan to collect data on what each of your states are doing around these initiatives. So we have some very straightforward questions. The first is simply asked to describe the process that you're going to use, and again, emphasizing the state association and state office should be working together to select agencies that participate in the initiative. So just briefly describe the process. And if you haven't begun that discussion, and that is the first year of the grant, is going to be that selection process, so you might not even be there yet, I think you could just simply say, we're waiting to begin this, but if you can, fill in your basic ideas about how you're thinking about running that process. Again, just so we have some ideas at the national level, you make sure those conversations are started, and then that way your RPICs can also discuss how you're going to go about doing that selection. The next question is on what are the high priority TTA needs of the agencies related to those community level initiatives. So if you can collect a little bit of data from your agencies about where they see their needs are, or especially based on what you're seeing in Module 3 of the annual report, or any other feedback that you've gotten from your agencies. This is going to be extremely helpful for the national partners in planning what TNTA resources that we're going to develop. So the better, more detailed data that you can provide us here, the more we're going to get a quick start in developing those resources. And then finally, there's just a general question about coordination on the issue, on the initiative between the state office and the state association. So again, we're just looking for no more than 1-2 paragraphs at the most describing how you're going to coordinate as the process moves forward. So we tried to make it as straightforward as possible. Again, we understand many of you will not have started the HCCT initiatives when you're filling out the needs of the TNTA template. So just do your best, and hopefully it will help spark that conversation. But as Mary Beth said, this isn't set in stone. We're not going to hold you to this. We just want to get some initial ideas so we can get as quick a start as possible when September 30th hits. So next section, I'll turn it back over to Pamela and Mary Beth.
Great. Thanks, Charles. So the next section here is around your training and technical assistance plan. And essentially, I think that what you'll notice here is that we're trying to reflect the ROMA cycle within this template. We start with the need, you identify the outcome, and then the strategies to address those needs and outcomes. And then we have that accountability by identifying who is going to be the lead for each strategy. So this is really the strategic plan for your overall strategies and outcomes based on those needs identified. We're looking for your overall broad strategies and outcomes. Strategies do not have to be written for every action step, or essentially your strategies do not need to have every single action step detailed is what I'm trying to say. What's your big picture plan is really what we're trying to get at in this template. So for instance, perhaps you're going to offer a Moodle platform to allow for easy access to state training materials, or you're going to host an annual training conference or support a ROMA cohort. These would be like the broad kind of strategies that we're looking for here. When you get to your outcome, make sure that you put that in ROMA language. Use SMART, right? Keep your goals SMART. Include as much detail as is reasonable to understand what you're hoping will change as a result of your intervention. So that might be a decrease in monitoring findings, an increase in staff credentials, or an increase in knowledge. Again, here's our overall theme again. This should be coordinated with the state office and the association. Each may have its own unique role, and that's really where that lead column comes in. So again, this is your broad plan, and it helps both the state office and the state association share a vision for the state TNTA goals and strategies. And I just want to point out that this is going to be useful to both the state and the region. The region can then coordinate on similar strategies or help bring in expertise, share that load. In some cases, there's an economy of scale that can be achieved by rolling up plans, your strategies and plans. So with that, team, anything you want to add? Okay.
Yep, I think that's good.
I'm sending it back over to you.
All right, so next we're going to talk about the SurveyMonkey component. So all of you will get a SurveyMonkey. Just a reminder that you're only filling out one per state. So, don't have the state association do one and the state office do one. You're just submitting one unified set of answers to that SurveyMonkey instruction. You'll also get a PDF form that has all of the options. So you can use that to sort of plan out what you're going to input, and then you can actually fill it out in SurveyMonkey. So we'll make sure that that PDF is included as well. And now, Courtney, if you wanted to switch over to the PDF itself. All right, and advance it to the next page. All right, so we do have some sort of basic demographic and financial information at the very front. So to begin the PDF, you would say what region you're in, what state you're in, and we do have a section for resources on funding dedicated to TNTA. It's helpful to get a basic sense of how much the state office, the state association, and the RPICs are contributing to TNTA. We're not asking you for, a detailed budget. This is sort of your best guess of what your overall funding is for TNTA. But again, that really helps us break out, our sense of what available resources there are, where that's coming from, and how those resources, sort of are aligned between the state office, the state association, and the RPIC. So again, your best guess is sufficient, and we're breaking it out. So again, you're saying how much funding for TNTA is there from the state office. So that's one number. The state association is another number. And then we want to know how much TNTA funding you get from your RPIC grant. So don't lump your RPIC funding into your state association TNTA dollars. We want to split those out because it just helps us see how much additional support is coming in. So I think that's relatively straightforward. And then we have categories of TNTA activities. So this is really your operational plan. So what you see on the screen, it'll take you through each section. And if you're not providing any TNTA in that particular area, you simply click no, and it would take you to the next section. So, however, if you are providing training on board governance, you would say yes, and it would take you to the next section. And what you will see is a list of topics, providers, and delivery methods. So under board-related issues, you see that list of topics. For every topic, you would have at least one lead provider. So that really helps us see who is providing TNTA on these different issues. And then you've got delivery methods. So, for example, let's say you were doing a year-long webinar series on board development led by the state association. So, Courtney, if you want to go one more level in. You have drop-down menus that include that topic, provider, and delivery method list. So on activity 1, you would say it is board development because that's the webinar series topic. The provider would be the state association, and the delivery method would be the webinar option. So I want to emphasize that, even though this is more of the operational level of what TNTA you're providing, don't feel like you have to capture every single last small thing. So, if the state office went and did one training with one agency, I don't think that would rise to the level of something that you would include here. But if you're doing a major webinar series, if you're holding, a 2-day in-person training, we want to capture the significant TNTA activities that you're using to implement the strategies that you've outlined in the previous section. So don't kill yourself capturing every single last webinar, but for your major TNTA activities, we do want to know what topics you're addressing. The main provider, so if there are multiple providers, just decide, who is the lead in that particular activity. And, if there are multiple delivery methods, choose the one that you're using most. Or if it's, a major TNTA effort, you could fill out several lines just using the same topic but indicating a different provider and a different method. So we've tried to cover all of the main areas of TNTA. I believe there are, I think, 15 different topics that we've tried to, again, break the TNTA activities into. And so you'll go through page by page saying whether you're planning on doing TNTA in this area, and then you're listing your TNTA activities, the provider, and the method. So Courtney's just going through those screens, but you'll have the PDF forms. So before you actually go in and fill out the SurveyMonkey, you can look at what your options are, take notes. and then hopefully the filling out of the survey will be a fairly straightforward process. So just want to emphasize one last time, we're not trying to capture every single last activity that you're doing. Be reasonable in selecting what you're going to fill out, but we want to try to capture those major TNTA activities, the conferences, the webinar series, the major in-person trainings, those types of activities, and that really gives us, at the national level, a good sense of what's going on in terms of how TNTA is being provided and who's providing it. At the state level, hopefully this is a good planning tool for both state offices and state associations to really think through what their main TNTA activities are. And at the regional level, it hopefully provides good discussion as states talk about, how are they actually delivering TNTA? What providers are they using? What strategies are they using that are effective, and where are their challenges? And this has been really helpful for us at the national level. As hopefully all of you know, we've been developing a series of guides for our Roma trainers and implementers to do training at agencies, and that was largely based on feedback that we were getting from all of you and, of course, the agencies, that what they really wanted on, especially some of these topics like needs assessment and strategic planning, was somebody at the agency who could do training specifically tailored to them. They like the conference presentations, they like the webinars, but they really want somebody at the agency. So this data has just been immensely valuable to us in helping inform national TNTA strategies. And again, we really hope it's useful as a planning tool to you and also as a way at the regional level to share what you're doing and learn from each other. So the webinar, the SurveyMonkey links will be made available along with the template. And so just a reminder, you're just filling out one SurveyMonkey, and we will also, as soon as you submit those SurveyMonkey answers, we will send you what you filled out, so you will have a copy of it. So that was a popular request the last time around, so we'll continue to make sure that we get you those survey answers to you, so you continue to use them as a reference point. So Pamela, Mary Beth, anything else about the SurveyMonkey component, or Courtney and Liza?
I don't think I have anything to add right now, Charles.
Yeah, I have nothing more to add either.
All right, and Liza Porras from our office is the main point of contact for the SurveyMonkey component. Me, Jarl, is the main contact for the overall TNTA template, and Mary Beth and Pamela, is it both of you or one of you the leads on this?
We work collaboratively together, but I will be the main lead on this. This is Pamela, okay, and I will be the lead, yes.
Great. All right, so Courtney, back to the PowerPoint for questions. So one more slide.
Charles.
Oh, very briefly.
Hey, Charles,
Yeah.
I'm sorry, there was one more section of the plan that we didn't review, the TNTA plan, the implementation plan.
That's right, the coordination. Sorry, I jumped too quickly. No. Courtney, if you could just put the last section, implementation, up, and Pamela and Mary Beth, we're going to cover that. There we go.
I'll be really quick, I promise. The question here, we're looking, again, this is a couple of paragraphs. This implementation plan is how are you going to work with each other over the course of the year? And each other being the CSBG agency, the association, and the RPIC. So the first question in here is around communication and coordination. So this may include your reporting plans or your regular RPIC calls, so on and so forth. And then the second question there is around how you will know that you've made an impact. This goes back to, this really reflects Roma. The question is, how will you ultimately evaluate those efforts? And you can always attach additional documents to provide those further details on implementation and evaluation plans if you have them. And that's it, Charles. Sorry, back to you.
Oh, not a problem. So just want to make sure you know where to, how you're going to be able to access the template and the SurveyMonkey links. So Courtney, if you want to go back to the PowerPoint. we are just about to ask you questions, get additional feedback. We are hoping to finalize everything by the end of next week, and at that point, we will mail out the template. It will be in Word form, so hopefully that'll be a flexible format for you to use. And we will also mail out the SurveyMonkey link that will be live that you can use as well, along with that PDF form, so you can review your SurveyMonkey options before you actually fill it out. We will also post this webinar and a copy of the template and the SurveyMonkey PDF under our Tools and Resources section in that drop-down menu. There is a State TTA Plan option. And we'll also include this webinar recording, so you'll be able to access all of those things on the partnership website, but look for that email out to you with the template itself and that SurveyMonkey link by the end of next week. So, Courtney, on to questions.
And I do see a couple that...
Yeah, we have a couple that have come in. First of all, a question about the leads for the different components. So again, just to make sure everybody's clear about who's doing what, the state association and state office sit down together and collaboratively fill out the template and the SurveyMonkey responses. You know, we want to make sure that this is an opportunity to do that forward-thinking planning for your TNTA activities for the year. Once you've done that, the state association will send the completed plan, and the SurveyMonkey will come directly to us. So you send the rest of the template to your RPIC lead, and your RPIC lead will then, on that due date, send all of your region's TNTA plans to OCS, the partnership, and NASCASP. And we'll make sure that you have all the right email addresses. Again, we're waiting to hear back from OCS on the final due date, but we anticipate it'll be similar to that October 19th deadline. We also... and a question for clarification at the national level leads. So who are the leads for the national partners? So the partnership has formal responsibility for the TNTA templates. It's under our Organizational Standards Center of Excellence grant. But we work collaboratively with NASCASP on this. So that's why we want to make sure, we're all available to answer any questions. But, of course, at the end of the process, those RPIC leads will be sending the TNTA plans to OCS, the partnership, and NASCASP. We also had a question... so I can follow up with a little bit more detail about the components of the plan, but you're sending one single integrated TNTA plan to those national partners to answer the question that's just come in. And I can follow up specifically. So then we had another question previously from a state office asking if we could align the TNTA sections on the SurveyMonkey with the drop-down menus in the state plan. And we talked a little bit about that, CAP and NASCASP, a few days ago. And, we're reviewing that list. We think part of the challenge is that the state plan list that state offices fill out is a little bit different because it's looking primarily at TNTA provided by the state office. So it's hard to align the list exactly. We may tinker a little bit with those 15 different categories to see if we can align them a little bit better. But there's not an exact one-to-one correlation. So for state offices, we're going to try to maybe get a little bit more alignment, but we're trying to be comprehensive in the type of TNTA activities that you're going to provide. So I think inevitably there's just a little bit of difference between the state plan TNTA list and the TNTA template list of TNTA activities. We had another question about whether we will include TNTA activities in the SurveyMonkey for the HCCT initiatives and community-level initiatives in general. That is a great suggestion, so we will put together an additional category in SurveyMonkey that will include, sort of basic TNTA activities around supporting community-level initiatives so we can get a better sense of what's going on there. So any other questions or feedback on the process? Again, open line, so you can either unmute yourself and ask or send that in through the chat box.
Hey, Jarl, this is Scott Engelmeyer from Kansas.
Hey, Scott.
Has there been any thought to separating out the HCCT questions and asking them later? We haven't gotten a lot of guidance right now from OCS on HCCT, and anticipating more of that once the new RPIC grant year starts, and wondered about maybe delaying that a couple of months or so that we're able to get some of that and sort things out. I have a feeling you're going to get a lot of haven't done anything responses to those questions.
And, that is perfectly okay, and I want to stress that. So, we understand that you haven't even started the grants as you're filling this out. So if you haven't done anything at this point, it's either, your best thinking. So, for example, on TNTA needs, let's say you haven't even assessed the TNTA needs of your network around community-level initiatives. If you could just give us, your best guess at what those TNTA needs are, even that would be very helpful. If you haven't even talked about your selection process, I think you can either do a thumbnail sketch of what you're thinking you might do, or if you're just not there yet, you can say, we haven't begun the process. And just to be transparent, we feel that we sort of have to include those questions because it's part of the HCCT grant that the partnership has applied for. There's pretty direct language about making sure we're collecting information on those initiatives through the state plan template. We feel like this is pretty much mandated from OCS as a component that we need to include. But, as I said, that said, if you're not there yet, it's perfectly okay to just simply say, we haven't gotten around to planning this, and then we'll revisit those conversations, most likely on RPIC calls as we start to flesh out what we're doing. So, I understand that this might be a little bit more of a challenge to give specifics on, but perfectly okay to say, you're just not there yet. Right, other questions or feedback, and of course, you can always follow up directly with us on email if you have additional questions or ideas. As I said, we're trying to finalize this template by the end of next week. So, if you could get us any additional suggestions, improvements, other feedback on the template itself by the end of the week, that would be great. And that way we can hopefully incorporate those into the template itself. But a lot of you have sent in suggestions in the past, so hopefully we're getting it a little bit better each time around. But your feedback is really helpful. So, concluding comments or questions? All right, anything from our partners at NASCASP to take us out with?
I don't have anything. Thanks, Charles.
All right. So thanks again for joining us on this webinar. It will be posted on the partnership website in that tools and resources section that I showed you. And please send any additional comments to both partnership and NASCASP staff. But otherwise, congratulations again on all our RPICs for finishing up and getting their grants in. Looking forward to working with all of you in the new fiscal year and hopefully seeing you at the partnership and NASCASP conferences in Chicago and Little Rock. So have a great day, and I will either see you on the road or in Chicago. Thanks, folks.
Thank you. Bye.